Welcome back. This week, News 24 reported that the ANC and DA GNU officials managed to strike a deal involving the National Health Insurance Act. The report alleged that the ANC agreed to drop certain sections of the act that would eradicate private medical aids. Minister Maropene Ramokgopa told the publication that the ANC and DA officials had come to an informal agreement during last week's cabinet lekgotla. While Health Minister has since cast some doubt over the finality of the deal, but the progress towards a compromise has been welcomed. For reaction to this, we are now joined by COSATU Parliamentary Coordinator Matthew Parks. Mr. Parks, thank you so much for your time this evening. What is COSATU's take on this informal agreement between the GNU partners?
Good evening. Thanks for having us. So, look, people can have discussions over coffee. South Africa is a free democracy. Anybody can talk about anything when they're having coffee. But the law remains the law. Parliament passed the National Health Insurance Act. The President assented to it, and the law remains the law. A cup of tea doesn't supersede a law. So if anybody wants to change a law, they must submit an amendment bill to Parliament. Parliament must consider it, have public hearings on it. It'd also have to go to NEDLAC as well. And then Parliament in both houses would have to vote on it. And so that none of that has been done. So a coffee table discussion remains exactly that. I think from our stance and what the President spoke of in the State of the Nation address was about rolling out the national health insurance. I think the President spoke quite clearly and firmly and eloquently on that point on Thursday, where government is going to move towards implementing the national health insurance. But it is always going to be a journey. It is going to take some time. This is the first foundation legislation that's been put in place. There must be a few supplementary amendment laws as well, we understand, and some regulations and so forth. But also most critically in the budget speech in 2 weeks' time and beyond that, what is critical is that Treasury allocates sufficient funds to the Department of Health to begin putting in place the infrastructure, putting in place the human resources, the medication, the IT systems and so forth. It also requires the taxation systems to be adjusted as well to put it. So this is going to be a journey. But a journey doesn't stop because people have had coffee discussions.
Does it worry you that there are certain coffee discussions that are being had without many of the stakeholders who are actually quite implicated in some of the decisions that would be made?
No, it wouldn't worry us. Look, we're a noisy democracy of 60 million South Africans. People have discussions all the time. We can't panic because people have had a chat. The law remains the law. And that's exactly why we put policy into law, so that it's clear to everybody and that people can hold government accountable if they don't implement it, that is binding upon departments to put resources available for it. Parliament too can also hold the relevant department, in this case, Department of Health, the Minister of Health, accountable as well. So the law remains binding. And I think the President, again, who is the first citizen of the Republic, the head of the state and government, spoke very clearly on Thursday in the State of the Nation address that we are moving ahead of the national health insurance. But it's going to be a journey. So we're not stressed because people have discussions. That's part of democracy. That's fine. I think for us what's critical really is to have a clear roadmap to make sure we put in place the resources. It is going to take some time, but I think we need to really put in place the foundations, especially with regards to human resources, because, we've seen a shortage of doctors. We've seen doctors having to perform double shifts, working 48 hours and so forth, exhausted to the bone. We've seen one nurse having to perform 2 or 3 nurses' jobs. We've seen a brain drain of skilled health workers from the public healthcare to better paying and less stressful jobs in the private sector, to better paying jobs overseas. And I think the bottom line, which we must always constantly focus on, is that both our public and our private healthcare systems are not achieving the results. They roughly have the same amount of resources allocated to them, but private healthcare medical aids basically cover about 14% of society. Public covers about 86% of society. So the public healthcare, as a consequence, is overstretched, is breaking at the seams, not able to cater for everybody. And as a consequence, people are dying of diseases that are easily preventable, identifiable, manageable, curable, and so on. And that means families lose breadwinners. They lose loved ones. It means workplace productivity is disrupted, which burdens the economy. It means the fiscus is drained of money which could have used elsewhere because of unnecessary premature deaths and so forth. But also the private healthcare industry too is struggling. It's extremely expensive. Most medical aid members struggle to afford the premiums. You find that premium day-to-day benefits are exhausted by April, especially if you have children and so forth. And many medical aid members forego necessary treatment because they can't afford the out-of-pocket payments, the co-payments and so forth. So the fact is we are an industrial democracy. well, yet we remain the tuberculosis capital of the world. We have people dying of diseases they should not be dying, and that's a drain on the economy. So national health insurance is not a boogeyman. It's simply saying, here's a path towards achieving universal healthcare. It means South Africans can live longer. It means we pull the resources together to ensure everybody has access to quality healthcare, that we put in place necessary doctors and nurses and paramedics, we put in place necessary IT systems and so forth. And private healthcare will still exist, but it'll be part of the national health insurance, which will indicate what is the closest available hospital, the doctor, and so forth. And the NHI will provide the fee payments to those service providers, be it public or private. And there will also be tariffs in terms of what people can be charged, because often you find that some of the payments charged by private healthcare service providers are just outrageous. They're far above what the product costs, and that means we are denying people the constitutional right to health. So I think for us, it's really, let's focus on implementation. It's going to take time. Let's see how we can make sure it's a smooth rollout. But ultimately, we should be working collectively towards universal healthcare for all South Africans, rich and poor.
So you keep emphasizing the fact that it is going to take a bit of time. It's going to be a long journey. And within this article, I mean, the leader of the Democratic Alliance, John Steenhuisen, said that he warned if the NHI were not removed from the MTDP as promised, the DA could not be party to the collapse of the private medical scheme sector and would have to reconsider its position in the GNU. Do you believe such stances will contribute to this journey taking much longer with regards to the rolling out of NHI and what the impact that would be on those who would benefit from the NHI?
No, look, it is critical that cabinet members engage each other, find each other. We want government to speak with one voice. We do appreciate it's not an easy journey because you have about 10 political parties, very different ideological persuasions, histories, constituencies, and so forth. But look, we must also respect democratic results. The sixth parliament passed the National Health Insurance Act overwhelmingly. The elected president of the republic has signed it into law. So it doesn't need to be in anybody's plan. It's a law. Plans are a program of action of a government. They're important, yes, no, without a doubt, but a law is a law. Law is binding. So if government, for example, didn't move towards implementing the national health insurance, society could take the state to court and say you have not fulfilled your legal obligation. But I think for us, we are more keen on solutions as opposed to, scoring points at each other. We don't really need to do that. And I think for us is really in the budget speech, let's begin to allocate the resources from the state to fund healthcare, to really make sure that our public healthcare facilities are ready, and to begin to provide a path for rolling out the national health insurance, putting in place the systems. And I think that's really critical because you want it to be a success. Society is naturally correctly skeptical of the state, given how many difficulties in various departments, municipalities, and SOEs. So it's critical that we put a lot of effort to make sure that it's resourced properly, its systems are built, the infrastructure is ready, and society also understands it thoroughly. But, to be fair to government, the national health insurance has been a debate of the past 20 years. The bill itself went through 5 years of engagement in Parliament, 70 hearings across all 9 provinces. We're not naive. We don't think it's going to happen by tomorrow, but we do want to see some significant progress towards achieving it. So I think it's critical the Minister for Finance's budget speech on the 19th of February that it begins to kind of provide the resources that is required to fund it. And that the Minister for Health, who is the executive authority responsible for the national health insurance, that in his budget vote, which will come shortly thereafter, he also begins to say, here's the plan to roll it out, from infrastructure to personnel to taxation issues to the legislative program and so forth. That will give confidence to society, but public service providers will still be there. The private GP will be there, the private hospital will be there, but they'll be part of a network of service providers, of public and private facilities who we enrolled in the national health insurance like it's done in other countries across the world. And people should understand that. It's not, and I think in this era, we've seen this past week, the era of fake news is not a helpful issue for society when we're dealing with very sensitive and complex matters. Nothing can be more personal to a person besides their healthcare. So we would appeal to everybody to treat this matter with a measure of calmness and sobriety, because ultimately I don't think any of us would want to see any South African denied access to quality healthcare. And that's what the NHI is fundamentally about.
All right. Thank you so much for your time, Matthew Parks, for joining us this evening.